You are listening to the Haig MD channel. Nothing on this channel is medical advice. It is for information purposes only, and before you make any changes, or if you need advice, call your own doctor. Hi everybody, it's Melissa Haig, the Haig MD channel. If you're watching this, you see the fun rabbit next to me. If you don't want to see that, hit subscribe repeatedly, and eventually I'll upgrade my audio. Anyway, today's sexual health hint, and actually the entire episode this time, is about vaginal estrogen cream. So I get a ton of questions about estrogen in general, and specifically estrogen creams and the differences and all of that. So we're going to talk about that. The first thing you need to know is, regardless of what you think or hear or read about estrogen, systemic estrogen, meaning estrogen you take in your mouth or put on your arm as a gel or as a patch, is not the same as vaginal estrogen. And when I'm using the general term estrogen, there are a lot of different kinds of estrogens and estradiols versus anyway, I'm not going to get into all that in this episode because it's not that relevant. But what I want you to realize is we use vaginal estrogen all the time, and actually in a variety of age groups and for a lot of different reasons. So I'm going to give you some examples of places where this is appropriate and great to use, and then also some things to think about. If you are 35 and you have found out that you have cancer and you are going through chemotherapy, believe it or not, that can really be destructive to the vaginal tissue. Why do you care? Well, there's a couple different reasons. The first one is it could absolutely increase your risk of urinary tract infections. The vaginal tissue, or what we call epithelium, meaning kind of skin of the vagina, is very sensitive to lack of estrogen, especially when it's abruptly stopped. And chemotherapy kind of pauses the ovaries. Certain types of chemotherapy pause the ovaries. If it stops your periods, you have to imagine it is stopping your estrogen production. And when suddenly that drops, that vaginal tissue can become thin, and that thinner tissue allows bacteria to travel through the urethra into the bladder, and you get what you would think of as a UTI or urinary tract infection or bladder infection much more easily than a woman who does not have that going on with her vaginal tissue. The other things that can be compromised with that in general is sexual function, and it can just cause general discomfort with urination. So some women may experience burning with urination, then they go to the doctor, they give a urine sample, and they're told, well, you don't have an infection. But that burning is because, again, the skin of the vagina, or the epithelium of the vagina, has become very thin because of that lack of estrogen. So we use estradiol cream or estrogen cream all the time to help women with that. And it can be, again, it can be a young woman who's going through chemotherapy. It can be an older woman who's going through natural menopause. It can be sometimes we use it in the pediatric population for certain skin conditions that we're trying to heal. The point is, vaginal estradiol cream, not the same as taking oral estrogen. It does not increase your risk of cancer to use vaginal estradiol cream. And there's actually been tons of studies done on this, especially in ladies who have experienced breast cancer. Because a lot of the fear with breast cancer is some of the breast cancers have estrogen receptors on the cancer cell, and it is thought that giving this woman estrogen will increase her risk of cancer. Now that could be debated, it's controversial, it's in some circles, but regardless, the estradiol cream you apply to the vaginal epithelium or vaginal tissue does not go into the bloodstream the same way as estrogen you put in your mouth or like a patch or a gel. What a lot of these studies have shown is for about 3 days after you start the vaginal estradiol, you may see a little bit of a peak in your blood levels of estrogen. However, it quickly returns to zero or baseline after those 3 days. Which again means if you are a woman experiencing menopausal type symptoms and you're thinking, I need to go on estrogen, just realize vaginal estrogen, not the same. It is not going to help your symptoms like an oral estrogen pill or a patch or a gel or something along those lines. So that's the first issue, is why would we use it? The next issue is, how do you use it? I see a lot of women who have been prescribed vaginal estrogen, and it comes with this little plunger thingy, and they are filling that sucker up putting it in, and then they go to bed and they hate it. It is absolutely the most annoying grossness when they get up in the morning, or if you're like a lot of women, you get up in the middle of the night to go pee and you just have this cream everywhere. For most things, and again, this is not medical advice, this is just general principles to think about. You should absolutely talk to your own doctor about how to use this. But for most things, we just have women apply a small amount to the opening of the vagina. And I tell women, probably the easiest way to do this is, I do not know a woman alive who does not pee before she goes to bed. All of us do that, ladies, because Lord knows we're going to be up in 2 hours to have to pee if we don't. So you go pee, you wipe, and then you can just put like a pea-size amount of the vaginal estrogen cream on the toilet paper and blot the opening of the vagina, and you're done. You do not need to put in inches and inches of cream that make a complete mess of everything. The other thing you should know about this, and I get this question a lot, is if I put this on and then go to bed and then I engage in sexual activity with my husband, is that a problem? And the answer is no. A very small amount of estrogen cream on the male tissue is not going to hurt him. It is such a small amount, it really doesn't get absorbed well. And even if it did, there's very little estradiol cream in a small amount applied to the female. So if you put it on and then you happen to engage in intercourse, you may want to reapply just because it may not have had enough time to absorb, but it is not going to harm your husband. The other question I get is, why does it burn or itch or irritate me the first couple days I use it? And I've actually had women call and say, I am allergic to this estrogen cream. I could only use it once and it burned and itched so bad that I stopped it. The best way I can explain that is, think of like, when you are in the winter and you're washing your hands all the time and they get like dried and cracking, and then you put lotion on and you're like, oh, that burns like crazy. Well, it's because you have all these little tiny cuts in the skin on your hands, and those little tiny breaks in the skin, when lotion or frankly just water hits it, can cause burning. It is the same thing with the vaginal tissue. When the tissues are very dry, when they have lacked estrogen for a while, and you first put something on it, it can cause that burning or itching sensation. How you know that that's the issue is you keep using it. Typically by day 3 or 4, that sensation, that irritated sensation is gone. Now, what can you do though? So you put it on and you're like, oh, this is killing me. The first thing you can do is apply some coconut oil. Remember, we've already talked about that. Miracle stuff, right? Coconut oil will often soothe the skin and get rid of the itching or burning or irritation. You can also apply a thin layer of hydrocortisone, just like over-the-counter cortisone 10. A thin layer of that to the vaginal tissues for a few days in a row is not going to cause you any issues. Or you can even let it sit there for just a few minutes and then put some ice on it. So bag of peas, best ice pack ever for the vulva and vagina, or even just a small amount of a cold compress to, again, you want to give it time for that vaginal estrogen to absorb. But if you need to soothe the skin because it's really bothering you, those are things that you would try. Because again, you're going to do this right before you go to bed. So it's really hard to go to sleep if you're thinking about your burny, itchy lady parts. Once you get to day 3 or 4, that sensation should be gone. If it is not, that might be the time to contact your doctor and think about, should we switch to a different base, because there are commercially available estradiol creams, but there are also compounded creams. So if you're having issue with the commercially available ones, you may want to think about a compounded one or vice versa. But again, it's actually quite rare for us to see allergies to this or real reactions to the estradiol cream. Never say never in medicine, because we are all different, but pretty darn rare. Now, once you have used it every night, that thin layer to the vaginal tissues, you should notice sexual function is much better. You should notice it's easier to achieve climax. It's easier to have self-lubrication. You should also feel like it doesn't burn or itch or feel irritated throughout the day like it was before. So usually once you hit 2 weeks, you've got a really good effect. Some women, if it's really bad, if it's been really dry for a long time, you're going to need to go more like 4 or 6 or 8 weeks of an every night application before you get to full effect. But regardless, once you feel like, okay, I got this, everything feels normal, just realize if you stop it, you get to go right back to where you were. So stopping the estradiol cream when you get to a good place, that's not what we want you to do. And I can't tell you how many women have come in and they're like, oh yeah, it worked great and I was feeling normal, so I quit. And now it all bothers me again. And I'm like, yeah, no kidding. That sounds like that's what would happen. So you have to keep using it. However, you don't have to be as frequent with it. Here's the problem though, with us humans. If I do something every day, I do it every day. So what I mean is, you do not have to remind me to brush my teeth. I have been brushing my teeth every day since I had teeth. It is something that is just ingrained in part of what I do. When you first start estradiol cream, it is not something you do every day. So if you decide, okay, I don't need it that much and I stop using it every night, then it's no longer part of what you do. And then before you know it, 3 or 4 days have gone by, and then 2 weeks, and then you're itching, burning, and having symptoms again. The best bet is to aim for it every night. And that way, if you only hit it 3 to 5 nights a week, you're probably still going to be okay as long as your vaginal epithelium or skin has healed. So all women that I know that are using this every night have a night or two where they get to bed and they're like, oh, I forgot. I don't want to get up to bed to do it. You're probably fine. Skipping it, like I said, a couple nights, no big deal. However, you've got to keep going. Now, for the patients that are going through chemotherapy for whatever reason, or on some sort of estrogen blocker for whatever reason, again, just realize a very small amount applied to the vagina and the vulva is not going to compromise your care in other ways. Again, this is not medical advice. This is just letting you know what the research says. Always talk this over with your physician. But I see so much fear around estrogen and even vaginal estrogen. I literally have patients that are so scared that they would rather go to the hospital with a really devastating urinary tract or kidney infection than treat the vaginal epithelium. And we don't want that approach. I have women in their 90s that are still occasionally using vaginal estrogen because it has kept them out of the hospital. Because as we age, sometimes we don't get those symptoms of a urinary tract infection, the classic like burny, nails through the urethra that you get when you're younger. Sometimes older women don't get those sensations, and their first warning that they have a problem is they are septic. They have a fever, their white blood cell count is elevated, something called their lactic acid is elevated, and they are very, very ill and end up hospitalized. So this can actually be something that keeps women out of the hospital and keeps them healthy overall. So don't have that fear of vaginal estrogen. So as we like to end every episode, love out loud and live on purpose.